Merhaba Habibis. Welcome back to Coco Canvas. We are here with yet another interesting video, and this time we are gonna go through the pelvis. The pelvis is the structural grand central of the human body. Today we are talking about a strict, high-yield tour of 25 landmarks that every medical student must master. No fluff, just high-yield anatomy. Let's ride. Let's start with the pelvic girdle. The anatomy of the pelvic girdle is that it's a ring formed by two hip bones, also known as os coxae. It connects the axial skeleton to the appendicular skeleton. Appendicular skeleton, let's just think of it as the legs. Alright. Stability is key. A double break in this ring usually causes significant internal bleeding. Let's move on to the ilium. It is the largest superior part of the hip bone. Think of this mnemonic. Ilium is the sky. Sky for superior. It forms the superior 2/5 of the acetabulum. Moving on, let's go to iliac crest. The highest point is at the level of the fourth vertebrae. This is the supracrustal plane, used as a landmark for lumbar punctures and the gold standard site for bone marrow biopsies. You could argue that it's the second best. Moving on, there is the iliac fossa. Its anatomy is that it is the large, smooth concavity on the medial surface. High yield is that it houses the iliacus muscle or the iliac muscle. Infections in the psoas muscle can drain into this fossa. Okay, let's go on to anterior superior iliac spine, ASIS. Here's a mnemonic. A cis is your anterior sister out front. Kind of funny. It is the origin of the sartorius muscle and the inguinal ligament. It is used to measure apparent versus true leg length discrepancy. Okay, moving on. Anterior inferior iliac spine, AIIS. It is just below the ASIS. Origin of the rectus femoris, the straight head of the rectus femoris. It is a common site for avulsion fracture in young athletes. For example, when a soccer player kicks with a stupendous force. Next is the PSIS, posterior superior iliac spine. The posterior end of the iliac crest. Look for the dimples of Venus. It sits at the level of S2, marking the middle of sacroiliac joint. Next, we have PIIS, posterior inferior iliac spine. Very simple anatomy. It's inferior to the PSIS. What makes it high yield is that it marks the superior boundary of the greater sciatic notch. Moving on, let's go towards the ischium or ischium. It is the posterior-inferior part of the hip bone. Think of it like this. Ischium is for the sichium, basically where you sit. Next, we have the ischial tuberosity or ischial tuberosity. It is the origin for the hamstring muscles, biceps femoris, semitendinosus, and semimembranous. Chronic irritation here leads to Weaver's bottom, or another name for that is ischial bursitis. Moving on, we've reached the pubis, the anterior and angulated part of the hip bone. Let's look at the symphyseal facet of the pubis. It is the medial surface that articulates with the opposite side. This joint, the pubic symphysis, widens during the third trimester of pregnancy due to the hormone relaxin. Next, superior ramus of pubis. It extends from the body to the acetabulum. It forms the upper boundary of the obturator foramen and provides an origin for the pectineus muscle. Next is the inferior ramus of pubis. It extends down to meet the ischium. It provides attachment for the adductor muscles, the inner thigh group. I assume you've already watched the muscles of the thigh video. Next, pubic crust. The superior border of the pubic body. Insertion point for the rectus abdominis, your six-pack muscles, and the conjoined tendon. Moving on, we have the pubic body. In the anatomical position, the pubic body and the ASIS lie in the same vertical plane. If they don't, the pelvis is tilted. Next, we have the ischial spine. It separates the greater and lesser sciatic notches, or sciatic, depending on whatever suits your fancy. Critical OB landmark. It defines station 0. If the fetal head reaches this spine, it's engaged. It's also the target for a pudendal nerve block. Moving on, greater sciatic notch. It's the large notch above the ischial spine. High yield. It is converted into a foramen by the sacrotuberous and sacrospinous ligaments. So you could call it the greater sciatic foramen. Clinical. The sciatic nerve and piriformis muscle pass through here. Compression of it causes piriformis syndrome. Next, lesser sciatic notch. It's the small notch between the ischial spine, below the ischial spine. The pudendal nerve and internal pudendal artery exit from the greater notch and re-enter the pelvis through this lesser notch. Now, let's look at the obturator foramen, the large opening between the pubis and ischium, mostly closed by the obturator membrane, leaving a small canal for the obturator nerve to pass through. Then we have the acetabulum, the deep wine cup socket. High yield, this is formed by the fusion of the ilium, ischium, and pubis at the triradiate cartilage, which ossifies in late teens. Then we have the lunate surface of acetabulum. The smooth, crescent-shaped articular surface. It's covered in hyaline cartilage and is the only part that actually touches the femoral head. Mnemonic luna equals lunate. It's the moon-shaped surface that takes the weight. Pelvic brim, also known as linea terminalis. It is formed by the sacral promontory arcuate line, pectineal line, and pubic crust. Once again, formed by the sacral promontory arcuate line, pectineal line, and pubic crust. You have the greater and lesser pelvis there. That is your greater pelvis, or the false pelvis, above the brim, protects the abdominal viscera. Then, within the pelvic inlet is the lesser pelvis, or true pelvis. Below the brim, it contains the pelvic cavity and the birth canal. Mnemonic: true is through, which means the baby goes through it. True is through. The baby goes through it. Moving on to the 25th landmark. It's very quick. Here's your sacrum. Now, it is 5 fused vertebrae, S1 to S5. This transfers the weight of the entire upper body to the pelvic girdle via the sacroiliac joints, SI joints. Right. Transfers the weight of the entire upper body to the pelvic girdle via the sacroiliac joints. Alright, so here's it. 25 landmarks, 1 pelvis, and a whole lot of clinical high yields. Master this, and you'll never be lost in the grand central of anatomy again. I hope to see you again pretty soon with yet another exciting video. Let me know in the comments what you're interested in learning. Take care.